and welcome to the first ESA closed meeting right out of Athens. It's been a great meeting since now, and thank you, Manos, for organizing this great meeting here right out of Athens. So far, we have a lot of discussions about the AC joint, treatment, pathologies, and aftercare.
We are very delighted to have you in Athens. We are very delighted to organize the first closed meeting for ESA. And we are welcome and have a nice meeting. When all this discussion, all this interesting, and it's always very nice to be a part of this.
This is a really controversial question because actually there is no clear agreement about that. Personally, I consider acute injury an injury, a dislocation within the first 3 weeks.
Actually, I treat it as 2 weeks as an acute injury.
An acute AC joint injury is an injury up to 3 weeks from the direct damage of the ligaments.
Well, the definition is not so clear in literature. We're talking about from 10 days to 45 days.
With a reconstruction of the CC ligament with dog button technique.
I use a arthroscopic assisted technique which is minimal invasive with dog bone.
Well, usually with an arthroscopic technique with buttons.
In acute injuries, I usually use arthroscopically assisted technique with a double suspension system to fix coracoclavicular distance, and then I address AC joint instability as well. That means in horizontal plane with additional reconstruction.
First 6 weeks, patients are not allowed to lift the arm more than 90 degrees. For the first 3 weeks, it's to 45 degrees. With the external rotation, I'm more progressive, so I allow the external rotation of 30 degrees directly post-surgery and 90 degrees after 3 weeks. And I focus on prohibiting overhead sports or heavy loads for 3 months because I believe that this time is also important for the adequate healing.
Well, in my mind, I prefer to stay a little bit slower. I would go for 6 weeks abduction, immobilization, trying to avoid any gravity stress over the joint, and after that I would try to restore the passive elevation, and once I recover the passive elevation I would go for rotations and whatever.